Agicetam 1200 Detailed information and precautions. Agicetam 1200 is a nootropic medication, meaning it is designed to improve cognitive function, memory, and learning ability. It comes in capsule form, each containing 1200 mg of Piracetam. Agicetam 1200 Detailed information and precautions. Agicetam 1200 is a nootropic medication, meaning it is designed to improve cognitive function, memory, and learning ability. It comes in capsule form, each containing 1200 mg of Piracetam. 1 Uses of Agicetam 1200. Agicetam 1200 is used to treat the following conditions. Memory impairment. It helps improve memory, learning, and concentration in elderly individuals, people with age-related memory decline, traumatic brain injury, stroke, or other conditions. 1 Uses of Agicetam 1200. Cognitive disorders. Agicetam 1200 helps improve cognitive issues like difficulty concentrating, slow reaction times, confusion, and difficulties processing information in people with traumatic brain injury, stroke, or other neurological conditions. 1 Uses of Agicetam 1200. Movement disorders. This medication might help improve symptoms of Parkinson's disease, Huntington's disease, movement disorders caused by medication side effects, or other neurological conditions. 2 Dosage and administration. The dosage of Agicetam 1200 is prescribed by a doctor based on the patient's condition and age. 3 Side effects. Agicetam 1200 is generally well tolerated, but some side effects may occur, such as digestive nausea, vomiting, abdominal pain, diarrhea, nervous system headache, dizziness, drowsiness, insomnia, skin rash, itching, hives. Other decreased white blood cell count, increased liver enzymes. 4 Contraindications. Severe kidney failure. Creatinine clearance 20 minute. This medication is eliminated through the kidneys, so caution is needed in patients with kidney problems. Patients with Huntington's disease. Agicetam 1200 may worsen symptoms of this disease. 4 Contraindications. Patients with liver failure should not take Agicetam 1200. This medication can be toxic to the liver. Cerebral hemorrhage. This medication can increase the risk of bleeding. 4 Contraindications. Pregnancy and breastfeeding. There are no sufficient studies on the effects of Agicetam 1200 on fetuses and infants. Therefore, this medication should not be used during these periods. 5 Precautions. Patients with kidney failure. Kidney function should be monitored, and dosage should be adjusted based on creatinine clearance. Patients with muscle spasms avoid abrupt discontinuation of this medication to prevent an increased risk of seizures. 5 Precautions. Patients with peptic ulcers, history of hemorrhagic stroke, or taking medications that increase bleeding. Caution is needed when using Agicetam 1200 due to an increased risk of bleeding. Patients with blood clotting disorders. Agicetam 1200 may increase the risk of bleeding. 5 Precautions. Elderly patients. Caution is needed when using Agicetam 1200 due to decreased liver and kidney function. 6 Drug interactions. Agicetam 1200 can interact with other medications. Inform your doctor about all medications you are taking, including prescription drugs, over-the-counter medications, herbal supplements, and dietary supplements. 7 Storage. Store this medication at room temperature, in a dry, well-ventilated place, away from direct sunlight. Keep this medication out of the reach of children. Note: the information about Agicetam 1200 provided here is for reference only and is not a substitute for the advice of a doctor. 7 Storage. Before using any medication, consult with a doctor or pharmacist for the most appropriate advice. Always read the instructions carefully before using this medication. Do not change the dosage or stop taking this medication without the doctor's consent.